Hello, everybody. Welcome to my Facebook Live. Today I'm going to be going over the knee and how is it that knee pain can potentially be caused by your back. So, if you have knee pain, if you have low back pain, or if you know anybody that does, which is probably literally everybody, please share this, like it, and spread the joy because I'm going to go over some things that I think are really important. Um, a lot of times patients come to me with various types of knee pain, and in actuality, we find out that either the pain A is directly coming from somewhere else, or B, the pain is indirectly coming from somewhere else. So I'll explain what that means because unfortunately there's a lot of misinformation that's out there, and sometimes people that have knee pain, they'll end up getting unnecessary treatment for their knee when in actuality there were other things that were going on. I'll give you an example of this. I do some second opinions across the country, and unfortunately, I talk to people all the time that either were offered a surgery for their knee or ended up, doing a surgery for their knee, and ultimately actually having continued pain because in actuality their pain was coming from somewhere else. So what do I mean from that? First, I'm going to describe a little bit of the knee anatomy, and then we'll be able to go from there. So first and foremost, what is the knee anatomy like? So I'm going to show you some things here. This is your femur, right? Your thigh bone, and then here is your tibia, and this is your fibula, your lower leg bones. And this is like you're looking straight at your right knee here. When you look straight at your right knee, you're also going to see your kneecap kind of sitting right here. In actuality, it's actually sitting in this nice little groove that's formed in the end of your femur over here, and your kneecap sits on top of that. So your kneecap kind of sits in this nice little groove right there. Then we have these other structures. We have these things called ligaments. The ligaments ultimately are the duct tape that connect bone to bone. And we have these ligament structures on the outside of the knee, and then we have these ligament structures on the inside of the knee. This is, for example, the ACL that football players keep on tearing. Then you have that PCL behind it. Now, these ligament structures, you may have heard me say this before in other videos. So a lot of people call them the duct tape that connects bone to bone, but in actuality, it's actually like they're those thick rubber bands that surround broccoli in the grocery store, right? There's a little bit of a stretch to them, but ultimately they're strong supportive structures. Now, we also have these cushions inside the knee called the meniscus. And these are these kind of ring-shaped structures. If you look at them from the top down, they're actually shaped like so. And these things have this cushion to them, and they're located right around here. And these cushiony menisci are essentially the shock absorbers of the knee. Picture them like the shocks of our car, right? And we have one on each side. Now, these are the kind of the main structures that are there. We also have ligaments connecting the kneecap to the various different bones. So you have ligaments connecting the kneecap to the femur on both sides. And then the kneecap itself is connected to the thigh muscles from the tendon here, and connects down to the tibia with the patellar tendon here. And that's all essentially connected to the thigh muscles here. Okay. And that's more or less the knee overall. Now, as we get older in general, there are things that occur to our knees. There's more pressure that's placed on these menisci over time, and over time these meniscus have some degeneration that take place. And that degeneration is a normal thing that happens as we get older, and that does not necessarily equal pain. But over time, as that shock absorber gets less shock absorby, the cartilage, the smooth surface of the bone, which surrounds these surfaces here, that smooth surface, that cartilage starts to wear away. And as that cartilage wears away, the bone underneath the cartilage starts to get a little rougher, and eventually the bone starts to get bruised. Eventually that bone starts to break down. And that whole spectrum that we just described there, that's called osteoarthritis. So going from the meniscus starting to break down, to the cartilage wearing down, to the bone underneath it breaking down, that's all a part of osteoarthritis. And with the exception of when the bone is actually breaking down, with the exception of that, the truth is that osteoarthritis does not necessarily equal pain. It's very common that I see patients come to me, "Doc, my right knee is killing me," and I look at them and their left knee has more arthritis than their right knee. So why is it that the right knee becomes painful, right? Why is it that that joint gets irritated? Well, when a joint starts to develop arthritis, it's easier for that joint to get irritated, and it's easier for that joint to stay irritated. But how does it get irritated in the first place? Well, that really comes down to the mechanics of how we're moving the knee. If we're moving the knee perfectly and we don't injure it, then there's no reason for it to get irritated. There's no reason for inflammation to occur, and knee arthritis may be perfectly fine. You can live with it and have no pain associated with it. But if we are walking funny, if we are putting abnormal pressure into the knee, then that can cause irritation. And what can cause us to walk funny? Well, several different things. Number one, if we have an injury to the knee itself. Number two, if we have things going on with areas like our feet, if we're flat-footed, or if we have an ankle injury or something along those lines, that can cause us to put abnormal pressure into the knees. But actually something that's very, very common, that's oftentimes neglected, is stuff going on in the hip and low back. And what do I mean by that? Well, in actuality, a lot of times we actually have muscles of our buttock and hip that are not firing properly, and that can actually cause abnormal pressure into the knee, and that's what I'm going to describe right now. So if we think about the body and the skeleton, we're going to talk about essentially the spine right now. Right? And this is going to be your little makeshift spine here. Here is your pelvis, and here is your rib cage here. And when we have the hip joint itself, the thigh bone looks like so. And your knee is going to be like that, okay? Now, what happens is we have these muscles around the hip, these muscles on the buttock region that actually come out and attach on the outside of the hip, okay? And the primary muscle there that I'm kind of drawing is the gluteus medius, or the muscle that's in charge of spreading our legs, right? If you're standing on one leg and you let your other leg kind of wing outwards, that happens, or like a side-lying leg lift, that happens because the gluteus medius is firing and making you spread your legs. Now, when this muscle fires here, right, when this muscle contracts, that causes the leg to go outwards, okay? And this is an integral muscle. This is a super important muscle because with every step that we take, that's the muscle that keeps our knees straight when we're walking. If that muscle is weak, then that'll cause the knee to actually go inwards. So if this muscle is weak, right, that'll cause the knee to go inwards. And what takes place when the knee goes inwards? Well, if you look at the knee joint again, okay, and you look at the knee joint like so, and let's say this is the outside of the knee, this is the inside of the knee. When the knee goes inwards like this, what's actually taking place is the knee goes like this. And when that occurs, you can see now that there's more pressure that's being placed on the outside of the knee. There's more pressure that's ultimately being placed on the meniscus here. And that's when this part of the knee can then get irritation because the knee is going inward, there's more pressure being placed there. In addition, things like the ligaments on this side of the knee are going to get stretched, right? So you can get a sprain of the ligaments on that side of the knee. And then finally, when we talk about things like the kneecap, when your knee is going inwards, that kneecap is actually going to be pulled outwards. And when that kneecap gets pulled outwards, that's going to be gliding improperly and causing pressure or pain in the front of the knee. So a lot of things occur if this muscle is not working properly, right? If that muscle is not working properly, a lot of irritation can occur in the knee because of the angle that the knee ends up going in. So what's a potential cause of that outside of the hip muscle or buttock muscle to not fire properly? Well, that actually comes down to the nerves that are going around that area, or going to that muscle rather. So what happens is we have various nerves that go from our brain down to our spinal cord, down to, let's see, I'll show you the spinal cord here if I can in a second. Down our spinal cord, and then these nerves exit out of our low back and go down our legs in different distributions. One of the most common nerves that gets irritated in the low back are the L5 and S1 nerves, and particularly the L5 nerve ends up being irritated a lot. Both of those nerves, though, are in charge of the gluteus medius muscle. So if there's an irritation to the nerves L5 and S1 in the low back region here, from a bulging disc or a disc tear or arthritis or anything along those lines, that can cause these nerves to not fire properly, which would in turn cause that buttock muscle to be weak. Super important, because a lot of times I have patients come to me and say, hey, my knee is hurting me. Oh yeah, I had sciatica, or I had some low back pain, or I had some tingling down my leg that occurred, but you know what, that's not that big of a deal. It's my knee that's bothering me. Well, we can do a cortisone shot in the knee, we can do a knee replacement, we can do, PRP or stem cell injections into the knee to help that knee out. However, if we don't deal with the underlying reason that the knee is getting irritated in the first place, well then, yeah, maybe you replace the knee, but then something else is going to be going wrong. Or maybe we do some PRP or stem cell injections, but it's going to only last X amount of time. So in order to really get longer lasting benefit, we need to strengthen the muscles that are keeping the knee straight. And sometimes in order to do that, we need to address the low back. Now there are also circumstances where the low back directly affects the knee. So what I'll do is I'll describe that in a second here. When we look at the knee on this side, that's a really crude looking knee there, but sometimes patients talk about pain directly in the front of their knee that's actually radiating up their thigh. So if you have pain that's kind of going in this direction here to the knee, nerve irritation in the low back could directly be causing that. The L4 nerve actually goes towards the front of the knee right there, and you could feel pain radiating up the front of the thigh and to the knee. And since it seems like the pain is in the knee itself, we can misinterpret that as being in the knee joint, but in actuality it's coming from the low back directly. Similarly, if we have pain in the back of the knee and we feel that that's radiating down into the calf or ankle, or it's radiating up the back of the thigh towards the buttock, that might actually be coming from the S1 nerve. So various different nerve irritations in the low back can contribute to knee pains in a few different ways. Either directly, if the nerve is referring pain to the knee, or indirectly, if weakness, because the nerve is not firing properly, is causing us to put abnormal pressure into the knee. Those are the different type of ways that the low back can actually influence our knee pain. I hope all of that made sense. Sorry about the quick drawings. I'll work on speed drawing a little bit more for next time. But the moral of the story is knee pain is not knee pain is not knee pain. Sometimes the pain is just in the knee and that's the issue. Actually, a lot of times that's the situation. But whenever we have something in the absence of a trauma and in the absence of an injury that specifically caused the knee pain, we have to take a step back and say, hey, are there other factors that are involved? What's the root cause? Is it the ankle? Is it the foot? Is it the hip? Or is it the low back that's involved with the knee? And only by taking a step back and looking at the root cause can we really address the whole picture and not only improve your knee pain, but try to prevent things from getting worse in the future and try to have some longevity, some long-term benefit from your care. If this made sense to you, if you have knee pain or back issues in the past, then please share this, like this. If you have any questions, feel free to comment or drop me a line. You can drop me a DM or email us at info@fxregencenter.com. Hope you enjoyed today's video. If you have anything else that you want me to talk or draw about, then please send us a line and I will see you next week. Have a great weekend.